हाय अर्पित। हाय, फर्स्ट ऑफ ऑल कॉन्ग्रेचुलेशंस। एंड मतलब अगर अपनी सर्जरी वाली लैंग्वेज में बोलूं तो बॉस ने फोड़ दिया है ना। सो गेटिंग रैंक वन इज नॉट इजी। बहुत मोटिवेशन चाहिए। इट रिक्वायर्स अ ह्यूज मोटिवेशन एंड अ कांस्टेंट पुश, along with that a discipline also. So first of all, once again a heartfelt congratulations from the entire Surgery Dada team, or you made us proud. So I want to ask, how did you manage this? Because I know you were in hectic residency also, because you kept on sharing all those cases, doing esophagus, and I still remember all those things. So how
Yes,
did
sir.
you
Yes, sir.
manage this? Because as far as I know, कि you actually were working. You was always working. साथ में तुम तैयारी भी कर रहे हो और पढ़ाई भी कर रहे हो. So how did you
Yes, sir.
do these things? Because the purpose of this interview is not to glorify the Surgery Dada saga. It is to help the juniors understand how the things can be done in a, you can say, smarter way. So tell me, how did you manage the things?
Sure, sir. Sir, thank you so much, sir, for inviting me on this platform. And sir, as you know, sir, I also work in Department of Gastrosurgery as my head of the unit, Dr. Prashant Mehta, sir, is also head of the Department of Gastrosurgery. So I have to work in Department of Gastrosurgery also. So we have lot of patients in GI surgery department. So sir, like जैसे हम ओपीडी में पेशेंट्स देख रहे हैं तो मैं उन पेशेंट्स को मैनेज करते हुए जो उनकी जो बीमारी होती थी, उनकी जो डिजीज होती थी, उनके बारे में मैं पढ़ता रहता था सर। जैसे सपोज मैंने आज ओपीडी में गॉल ब्लैडर कैंसर का पेशेंट देखा या फिर पेरिएम्पलरी कैंसर का पेशेंट देखा, तो आई यूज टू रीड दोज टॉपिक्स फ्रॉम द स्टैंडर्ड टेक्स्ट बुक लाइक ब्लूमगार्ट एंड शैकलफोर्ड, and I also used to read Sabitson also, and yeah, that is the way of reading GI surgery.
That's
So you have to read the patient, not textbook.
that's very important point, and actually this is what the youngsters are losing. कि उनको लगता है कि बस एमसीक्यू सॉल्व करो बॉस और थियरी पढ़ते रहो and eventually you will crack. But the best learning that you get is from the patients. Basically every patient is going to teach you something, because कुछ patients ठीक हो जाते हैं and कुछ patients में you end up with complications. So जो
Yes, sir.
complications होते हैं ना, they make you study and read that topic again. That
Yes, sir.
yes, you have to check where you were wrong. So that's a very important point. So how did you manage the time to give to the theory, uh, and what was the time did you allocate to the MCQs, to theories, and how much time were you investing in your preparation?
Yes, sir. Sir, as I'm working as a senior resident also, so apart from my duties, which are usually in OPD days 4 to 5 hours, and on the OT days it usually 7 to 8 hours. And after managing my duties, I used to study around 6 to 7 hours a day. And basically for INISS, I started preparing from the April.
Okay,
And for October session, I dedicatedly studied from the August.
okay, that's great. That's great. That's
And sir, as OPD timing is 9 to 1, so before going to OPD, I used to study 2 hours.
correct.
And after coming from the OPD, I take rest 1.5 hour, and then I started studying.
Arpit, that's a very disciplined, you can say, attitude of yours. And I still remember you used to text me the questions, and you used to, and from आज से नहीं, पीजी के टाइम से ही है ना, you used to connect with me on WhatsApp, basically texting me the
Yes, sir.
questions, the queries. And I still remember when I launched Surgery Dada, you were, I think, the student number 4 or 5. I think we had a special code for you, and and you remember, you must be remembering that I told you that you will do great. You will do
Yes,
great.
sir. Yes,
Do you
sir.
remember that? I
Yes,
have
sir.
written you in message
I
also.
remember that. I remember the day also. It's 16th of October, 2023.
Yeah, yeah. I said you will get a single digit rank, because इस फील्ड में इतने सालों से हैं, we can just look into the eyes and the nature of a student and decide and tell, यार ये बॉस ये बंदा है जो करेगा. So I want to ask you, why GI surgery? So ये एक बहुत important question है, because this is super specialty now. So
Yes,
why
sir.
GI surgery? There are other options, like many days nowadays. Many of the students are also opting for urology, basically thinking कि urology में काम कम है, emergencies कम है, and GI is bit hectic. I know GI is थोड़ा सा interesting. So what was your take towards GI?
Sir, people find GI surgery as a hectic branch, but I find this is a thrilling branch.
Yeah, exactly.
So there is no surgery without thrill.
Yeah.
So I decided that I will take GI surgery after my internship also. And when I took admission in my post graduation program, so I took BJMC only because my head of the unit is the HOD of Department of Gastrosurgery. So
Okay.
I have more exposure of gastrosurgery. So we do from esophagus to anal canal each and every surgery, except from liver. We do each and everything. And my professor, Dr. Prashant Mehta sir, is very helping and very kind. He taught me each and every surgery hand by hand. Even I can. He taught me laparoscopic also. I can do laparoscopic suturing also, sir. So that gives me a thrill, and that gives me a confidence, and that boosts my confidence to pursue GI surgery.
Yeah, yeah, that.
Sir, I still remember in each and every major surgeries, sir stand behind me and taught me how to do the step. He even not scrub. He just stand behind me and taught me how to do that particular step in that surgery. And even laparoscopy, he taught me from the monitor. He do like that, do like this, and yeah, I'm very grateful to him.
No,
Sir,
you.
he taught me esophagus. I did independently esophagus and ample amount of splenectomies, LPGs, choledochal cyst. He taught me made a pouch, ileal pouch anal anastomosis in ulcerative colitis and familial adenomatous polyposis. Sir, I am very grateful to him, and that is the main reason I love GI surgery, sir.
तो देखो, ये एक बहुत बड़ी बात है. यू आर ब्लेस्ड एंड यू शुड बी थैंकफुल टू गॉड. You have mentors, because nowadays there's a crisis that mentors don't teach. Okay, they use, okay, ठीक है, you are there to take care of my patients, but no one is willing to teach. So you should be thankful to God कि you got good mentors who have always helped you, and basically आज उन्हीं की वजह से you got yourself shaped. Basically it is your hard work, but the direction,
Definitely.
the motivation, the discipline, that is all because of the, you can say, mentors. So how Surgery Dada helped you in this journey to, you can say, rank one? So what was contribution of the Surgery Dada? Because that's a new platform. Earlier I was associated with many other platforms, but
Yes, sir. Yes, sir.
started with my own platform. And how Surgery Dada was it helpful to you, and how did it help you?
Definitely, sir. I subscribed to your live classes during my NEET SS preparation last year,
Yeah,
which is still continued. And I used to join all your live classes.
yeah, yeah.
And
Answer the
sir, I
questions also. You used to
yes,
answer.
sir.
Yeah, you used to answer.
Yes, sir. Yes,
That's visible in the, you can say, recording also. If you see the chat.
yes, sir. Yes, sir. So that helped me in rapid revision. I used to use Surgery as a platform as a revision source. I basically read from all standard textbook, and when I am revising, you have to revise in very quick time. So that is very helpful, as all the videos are very nice and nicely crafted, so that you can complete your topic in just short span of time. So that is the main key. What I see in Surgery Dada.
We are also using the standard textbooks like Shackelford, Blumgart, Maingo. If you're going through GI part, you will see entire replica of Maingo and Shackelford. That is
Yes,
what.
sir. That's why it's very easy to revise from your video, sir. That's why it's very easy.
So now everything is done. What are your plans now? बहुत सारे लोग हमेशा पढ़ाई की बात करते रहे. I know you have got engaged, and congratulations. So now what? How are you going to plan from here? Because ये एक बड़ा conventional question है कि how you are going to settle down. So you'll now do MCH, and first of
Yes,
all,
sir.
where you want to settle?
Sir, its preference is Ahmedabad only, which is my hometown. But it's I'm ready to move anywhere else also if I get opportunity. So it's not like that I have to stick to Ahmedabad only. But yeah, I can shift
And
based
what
on opportunities.
what college are you expecting? Are you going for AIMS or PGI,
Sir,
whatever?
my first preference is AIMS New Delhi,
Yeah.
and after that I'm asking people's what to do, and
That's great, and definitely you'll get. And one more thing that I want to ask you: how did you manage? Because getting a rank by studying you can say for 2 months is not possible. And I know you were a dedicated student right from your, you can say, I know you from your MBBS days. So from MBBS to PG and that residency part. So how did you take your residency? Was it boring? Was it challenging? Was it, you can say, did you enjoy that? So how did you manage the residency, the learning, the discipline, everything? Because this is must know for every student watching this video. This residency is the most crucial phase of your life. Either you can enjoy it or you can waste it.
yes, sir. Sir, initial few months of residency was very difficult for me because, sir, at BGMC we have very hectic duties and lots of patients to manage. So yeah, initial 5 to 6 months was very difficult, but I get to manage all that difficult time, and yeah, after that I'm pro at BGMC. I can do each and every work within a very short time. So that helped me to save time and enjoy my life also with residency.
Local factor आ
But
गया.
initial period you have to struggle, and from that struggle you will be gold.
So, everyone who is watching this webinar, let me tell you, it's not about rank one. You should learn something which Dr. Arpit has told you, that it is not the textbooks only that teach us. It is the patients who are the first textbooks. It is the first reference that we have from the patients, and then we actually counter refer to the textbook. And that is why when you correlate both of them, you learn. And this is very good thing that you have adopted, Arpit, and a very important message that you have given to the junior. Any you can say message that you want to give to all the, you can say, young aspirants who are still struggling, and there may be MBBS students who might be watching you at the pinnacle of your, you can say, of your success. So this is just a beginning. You have a humble start, but I wish you go to the, you can say, great heights. So any message for your juniors, for, you can say, the lovely ones, MBBS ones, who are just enjoying their life right now? So, and
Uh,
they're, and you can say, they are having that attraction to become a surgeon. Any message for them?
So I can say only that you have to enjoy your life also, but this is also your crucial part of your life. In that you have to shape you. You have to carve your future by yourself only, and you have to study hard also, and you have to enjoy your life also. So you have to balance that both those things, and yeah, that is what I want to say.
एक बहुत एक कॉमन सा क्वेश्चन है आजकल, जूनियर्स जो है वो ये बात कहते हैं कि सर्जरी इज ओवर, सर्जरी इज डेड, कुछ पैसा नहीं है, ये नहीं है, वो नहीं है. सो how do you take this? Like, let me tell you, before just before this interview, I finished just 2.5 hour surgery. Basically, I was doing a TLH with severe endometriosis, and then the suturing was very tough because uska vault jara sa chota sa bacha. So it would be easy that if I go for a vaginal closure of the vault, but still I preferred that, okay, I will go for endo suturing, means I'll go for endo suturing. And we finished that in 2.5 hours. And I had some problem with my, you can say, right knee. So I'm having some trouble with the meniscus. There is a meniscal tear during tennis. But still, I got my leg frozen. But वो जो एंथू था
That
ना,
feeling,
जो किक
that
थी,
feeling is
एड्रेनलिन
very
रश, सारा दर्द सर्जरी के बाद समझ में आया.
exactly.
ना पैसा समझ में आता है ना कुछ. वो जो किक है ना, यू विल ओनली अंडरस्टैंड व्हेन यू आर अ सर्जन. सो व्हाट इज योर
Exactly, sir.
टेक?
Exactly.
बिकॉज मेरे को तो व्हेन आई से कि ओके आई हैव एवरीथिंग दिस एंड दैट, दे स्टार्ट मेकिंग, जेन जी, दे आर गुड ट्रोलर्स. वो तुरंत कमेंट लिखते हैं, इनका ये ऐसा है, इनका वो ऐसा है, इनके बैकग्राउंड में पैसा है, दिस एंड दैट. नॉट एवरीवन इज डूइंग. माय मैसेज इज दैट you're not you are not surgeon by chance, you are by choice. And
Born
surgery
surgeon.
is not about, yeah, and surgery is not about minting money. It is about the
Definitely,
kick.
sir.
We are basically,
Kick.
हम तो वो हिंदी में बोले तो हम वो स्मैकी हैं जिन्हें स्मैक ना मिले तो मजा नहीं है. तो हम वो, फॉर अस, अगर सर्जरी ना मिले, वी डोंट हैव ब्लड ऑन आवर हैंड्स, वी डोंट फील.
Yes, exactly.
घर पे लड़ाई होती रहती है, मतलब किसी को डांट दिया, स्टाफ को डांट दिया, पीपल आर नोइंग दैट वो विड्रॉवल है. सो टेल देम फ्रॉम माय पॉइंट, आई हैव एक्सप्लेन्ड, टेल देम दैट हाउ डू यू फील. कभी सोचते भी हो कि नहीं मुझे सिर्फ पैसा ही कमाना है, और the satisfaction that you get after operating on a patient, maybe you do surgery for 4 hours, but 4 घंटे बाद when you get exhausted and you have a cup of coffee and you are relaxing, मजा आता था, यार मजा आ गया, आज खतरे से खेल के आए हैं. So what is your take on that?
Sir, I also only want to say is don't run behind money. Do आपका अपना काम ईमानदारी से कीजिए, मनी आप अपने आप पीछे आएगी. So yeah, you have to do hard work. That is the only key.
And
Nothing else.
and dear students, surgery is not about minting money. ये गलत है. वो तो ठीक है, थोड़ा सा अच्छा करोगे, you'll definitely get money. बट वो जो लेवरेज द स्वैग दैट यू गेट, एक मेडिकल कॉलेज के अंदर वो जो सर्जन्स का स्वैग है ना, वो रुतबा ही अलग होता है. वो रुतबा है, उस रुतबे के लिए हम काम करते हैं, हम पैसे के लिए काम नहीं करते, इजंट इट? या एंड
Yes, sir.
वो जो
Yes.
टैग है, हैवीनेस है कि नहीं यार, कुछ भी पेट खोल के निकाल सकता है, कहीं से भी कुछ निकाल सकता है, जोड़ सकता है. दैट इज द फीलिंग दैट वी गेट. सो दिस ब्रांच, all the youngsters who think that surgery is dead, this branch cannot be measured with the amount of money. You can only treasure it by the emotions that a surgeon carries. और वो चीज अगर करना है ना, तो स्क्रब पहनो, तब समझ में आएगा. मैं आई वेंट फॉर अ सर्जरी, केम इनसाइड एंड माय असिस्टेंट सेड कि सर चेंज कर लीजिए, आपकी मीट है, दिस एंड दैट. आई सेड, डू यू नो आई एम मोस्ट हैंडसम इन माय स्क्रब्स. अब पता नहीं दूसरे वाले को क्या लगे क्या नहीं लगे, अगर एक दो ब्लड की छींटे हैं तो और भी अच्छा है ना.
Yes, sir. Exactly.
So I wish you all the best, and you have set an
Sir,
example. Yeah,
I also want to tell the young budding surgeons
yeah,
that always follow your guide, always follow your seniors.
yeah,
Even if you think यार ये क्या बोल रहा है, ये पागल है यार, ऐसा थोड़ी ना होता है. But they are always right, that you will realize when you become senior.
yeah, exactly. हाँ, बिल्कुल बिल्कुल. And
So always follow your guide, always follow your mentor, and yeah, that is the key to success in surgery.
till
That's
date,
all.
I am a proud student of Professor Basu, and he's more than a father, he's more than God to me. So till day, अगर आज भी कभी कुछ कहीं भी डाउट होता है, कहीं भी मतलब आई एम फीलिंग डिप्रेस्ड, कुछ भी होता है, कॉल सर. कभी ये नहीं सोचता हूँ कि मतलब क्या सोचेंगे क्या नहीं सोचेंगे. एंड डू यू नो, ही इज सो हम्बल, इज सच अ जेम सॉर्ट ऑफ पर्सन. मतलब वो हमेशा लाइक अ चाइल्ड, मतलब वो नहीं, एक किंडरगार्टन के जो बच्चे होते हैं उस तरीके से मेरे को समझाते हैं. एंड ही गिव्स मी द बेस्ट एडवाइस. सो इट इज एक्चुअली द सीनियर्स, दिस इज अ ब्रांच वेयर वी सेट द डिसिप्लिन, follow the discipline set up by the seniors, and then we actually modify those things as the time passes. So, Arpit, thank you for joining us, and an entire Surgery Dada team is proud of you. Again, once again, congratulations. Congratulations. You nailed it. You made it. Okay. Thank you.
Thank you
Thank
so
you
much,
for
sir.
joining
Thank
us.
you.
Okay. Bye bye. Have a nice day.
Thank you, sir. Thank you.